Welcome to the West Valley Industry Spotlight. Today, our focus is the healthcare industry. We're really glad that you joined us today. I'm your moderator, Christine Gannon. I'm the CEO of Brightworks Consulting. Today's webinar is recorded, and it's number 3 in a series. We've also had a webinar on advanced business services and IT, and you can find these on the Westmark website. We've titled the progression of industry events the West Valley Industry Spotlight and Virtual Job Matching Series, which works in collaboration with the 15 communities of the West Valley, supporting 1.7 million residents in the West Valley. This webinar series brings together subject matter experts in industry, workforce training, and education to highlight the needs, opportunities, pathways, and most importantly, the resources for careers in target industries. There's also a job matching component that will connect employers and job seekers based on the skills via the PipelineAZ platform. Both employers and job seekers receive assistance with onboarding and career navigation free of charge. A couple of housekeeping items for our time today. Additional resources will be provided to every registered participant after this webinar. And the job matching component that I just spoke about will take place between April 6th and April 27th. If you haven't already, please complete your profile to participate in the job matching event. Go to westmark.pipelineaz.com and we'll drop that in the chat for you. For a little bit of additional context, the West Valley Pipeline is the West Valley Regional Workforce Development Strategy. It's the only regional workforce development strategy in the state. And this series that we're doing, this webinar series, supports that strategy. And the intent is to spotlight the industry and connect job seekers and talent with West Valley employers. We have many in attendance today. Thank you. Before we introduce the series, let me thank our sponsor. Arizona State University's West Campus is the title sponsor of the Industry Spotlight series. The following ASU entities bring this effort to the West Valley, and they include the ASU College of Health Sciences and Solutions, ASU Edson College of Nursing and Health Innovation, ASU New College of Interdisciplinary Arts and Sciences, and the ASU Office of Government and Community Engagement. And now we'll see a video from our sponsor. Thank you to ASU, and thank you to University of Phoenix for their sponsorship of this healthcare spotlight. And now I'd like to move into our panelist and subject matter expert discussion. Our first industry subject matter expert is Trevor Stokes, and Trevor is making the world of work understandable as CEO of the Partnership for Workforce Innovation. His extensive background in labor market analysis includes more than 400 regional labor market studies conducted for school districts and workforce boards and Department of Education, along with economic development organizations across the country. Trevor, welcome.
You would think this far into the pandemic, no one would ever again forget to unmute themselves when they're supposed to be talking, but I did it again. Good morning, Christine, and good morning to everybody else. I really appreciate the opportunity to be with you. I always enjoy an opportunity to work with Westmark on anything because I always feel like I am with my neighbors. I've been a West Valley guy since I moved here 7 years ago. Things have changed over the course of 7 years. It's a new world in which we're living, as evidenced by the fact that we can now attend major high-profile events like this one, with a shirt and tie on the top and Scooby-Doo boxers on the bottom. So let's look at the healthcare sector across Maricopa County, and in particular here in the West Valley. I wanted to give you a feel for the industry, and Kimberly, I need control for this presentation, I believe. There we go. So I wanted to share with you a couple of trains of thought. Number one, the value of this sector to the community, and then number two, the value of this sector in terms of the career opportunities that are available to students and job seekers, career changers who are looking for high value career opportunities. So that's what I want to share with you today. I want to start with the concept of value to the community. Since most of you here today are living every day in this sector, I doubt that you will be surprised to see that healthcare and social assistance, which is how we categorize the industry in the labor market information systems, is the largest employer across Maricopa County, followed by government and then retail trade, making it by a wide margin the largest private sector employer across the county. Healthcare is a very broad industry, of course, so what are we talking about in Maricopa County when we use this very general term healthcare? Well, 1 out of every 5 jobs in this sector are actually in our hospitals, followed by offices of physicians, and then one you'll see mentioned again in just a minute, services for the elderly and those with a disability. There has been a remarkable growth trajectory in the healthcare sector since 2016. More than 2,000 new establishments have been opened in Maricopa County over that short 5-year period. That is a remarkable growth trajectory, which has been led by our largest subsectors, including hospitals and offices of physicians. But the real striking levels of growth that I wanted to point out on this third row, services for the elderly and people with a disability, and then the fifth, down a little bit lower, the outpatient mental health and substance abuse centers. Those are the sectors in which we have seen the largest growth across the county in these recent years. So what does that mean in terms of impact on our overall economy? Well, what it means is that healthcare and social assistance is now essentially tied with the finance sector as the largest private sector contributor to our regional economy. This, I promise, will be as far as I go down into straight up economist nerd content on you today. But I wanted to show you this one fairly complicated slide because as I tracked the change in our regional economy, as indicated by these red bars, I thought it was interesting to compare the growth trajectories of a couple of our very high-profile sectors, healthcare, construction, and manufacturing. There are stories that we can tell about our industry, right? And that's one of the things I want to zero in on today. When I look at this, what I see is a growth trajectory in this industry that is consistent. It outperforms the economy overall. It is consistent in its demand levels, doesn't experience the ups and downs that are often dictated by swings in the economy. One thing I did specific to the West Valley was to use a different data source, which allows me to see the types of jobs people report holding regardless of where the job is. In other words, this data is based on where the employee lives, not where the job is. So people who are living in the West Valley most likely are in an office or administrative support job. That is the largest type of job across all of our 6 major communities that I was able to track. However, we have 3 different categories for healthcare related occupations, which you see at the bottom: health diagnosing and treating practitioners, support, and then technologists and technicians. And those combined make the healthcare occupations one of the largest components of the workforce here in the West Valley. Again, speaking to the critical nature of the healthcare sector to our economy, as well as to the careers and career trajectories of the people in our communities, right? So the Office of Economic Opportunity projects growth for every industry and every occupation every 2 years. And there are changes that they project coming in Maricopa County that are concerning to me as someone who keeps 1 foot in the world of economic development, 1 foot in the world of education, and this weird 3rd foot in the world of workforce development. Because there's an intersection point, a nexus of those 3 worlds in which the idea that we need 18,000 more nurses terrifies me. Where are we going to come up with another 14,000 health technologists and technicians? The talent development ecosystem is the lifeblood of our business community, because business at its essence is people. And the people who are providing services on behalf of our healthcare providers are the most critical component of the success of those businesses. And as I showed you at the beginning of this, the welfare of those healthcare businesses is integrally tied to the state of our overall economy. So I looked at the emerging talent supply. I looked at the post-secondary educational institutions and the largest programs that they have within the healthcare fields. And I looked at the number of graduates coming out of those programs and compared that to the number of annual openings in related occupations. That allows us to see what I call a workforce equilibrium value. Anything like this is imperfect, but it does start to give you some perspective on programs that have a significant difference between the emerging supply and the projected demand. So looking at our post-secondary institutions, I saw a few things that I thought would be worth mentioning to you as I close this out. Number one, we've had a trend in recent years towards shorter term learning, more certificates, and away from degrees. Every level of degree from an associate's degree on has seen a decline in the total number of awards since 2012, while the only category to see a total increase has been at a level below an associate's degree. So you'll see in the middle of this graph the downward trend, not dramatic, but a slight downward trend in recent years for some of our highest demand sectors. Lastly, one area that I want to mention as a critical component of our talent development ecosystem is our high school level career and technical education programs. here in the West Valley, we have some phenomenal programs, and I am a huge champion of career and technical education at the secondary level, because this is the point at which a lot of our students first get introduced to the high value careers that we hope will bring immense value to them personally, as well as to our communities as a whole. And the good news, across all of Arizona's high school CTE programs, the most popular category of program we have are the health sciences programs. So with that, I want to close with a couple of thoughts. Taking all of those things into consideration, I hope that you as industry leaders will continue to engage in this conversation. These issues are not simple. Supporting an industry sector as complex and as dynamic as the healthcare sector requires a lot of different perspectives, and it will take a lot of high-level conversations and efforts and initiatives to actually move the needle on the quality of the workforce available in this sector. Number two, I hope we'll commit to career literacy. A lot of our youngest students, a lot of the people just entering high school who are starting to get some fuzzy idea of where they want to go on a career trajectory, need information about the career opportunities that exist within the healthcare sector. We track 5 different pathways in the CTE system within health sciences. There's a role, a spot that would be rewarding, would be valuable for every kind of individual and every kind of student. And lastly, I hope that you'll continue to contribute to this effort on a community level. That means participating in these Westmark initiatives, continuing to commit your time, your resources, because I can promise you that it is very much appreciated. So with that, I hope some of that was interesting and valuable, and I really appreciate the opportunity to be with you. If I can answer questions or be of value in any other way, please don't hesitate to reach out. Christine?
Trevor, thank you so much for that presentation and appreciate all the insights. I just want to share with our participants today, please use the chat box if you have questions for any of our guest panelists. We have some time built into our agenda today to answer those questions. Also, I saw that someone asked if you will be receiving the slides, and all of the resources that we're talking about today will be provided after this webinar. I'd like to introduce our next guest panelist, Leah Hill from Honor Health. As a Valley of the Sun resident for over 30 years, Leah holds a master's degree in organizational leadership and project management. She's nationally recognized as a workforce development professional. She enjoys creating and enhancing pipelines, partnerships, and pathways to healthcare employment at Honor Health, while developing initiatives to upskill the valuable healthcare workforce. Leah, welcome.
Thank you, Christine, and good morning to you all. So glad to be here. I'm personally very stoked, geekily, after hearing Trevor's presentation, but my job for all of you now is to put it to real life and help connect the dots as to what it means to the West Valley and to our Phoenix Valley, even our region as a whole. So today I wanted to go ahead and share with you just a little bit more about Honor Health and where we are growing within the West Valley, the Phoenix area, and where there are opportunities for continued collaboration, job growth, and just many more opportunities to look at ways that we can together grow this fantastic place we all call home. So for those of you who may not be familiar with Honor Health, we are a nonprofit community-based hospital system, mostly based with locations. Our 6 medical centers are in Phoenix and Scottsdale, but our 70+ medical group locations span all reaches of the valley, from Lake Pleasant to Fountain Hills and from Anthem to South Tempe. We have over 12,500 employees, and we really walk the talk when it comes to our mission, our vision, and our values. And that's what we're looking for, not only within our current workforce, but our future workforce as well. And for those of you who are familiar with the medical industry and what recognitions we really strive to achieve and to maintain, it's our recognition surrounding diversity, equity, and inclusion, as well as belonging. So that includes all individuals, We all have visible and invisible differences that make us who we are, and Honor Health really strives to not only honor but respect those not only within our employees but our patient populations as well. And we also are magnet recognized, which is one of the highest honors for nursing professionals, but really it's an honor that we all share across the board as healthcare professionals, saying that we attract and retain the best of the best in talent, and we're committed to collaboration and ongoing growth and development of our employees. And some of you may also be familiar with our Noaa Clinics, which are also part of the Honor Health family. Neighborhood outreach, access to health, and those clinics specialize in medical, dental, behavioral health services for all populations, but especially those who are underserved or maybe immigrants or migrants. So here's just a brief snapshot of some of our all of our Honor Health locations throughout the Valley. The purple H's are our hospitals or medical centers. And then our blue, yellow, and green icons represent our Honor Health Medical Group locations. And as you can see, we're proud to be part of the West Valley with locations in Lake Pleasant, Glendale, Peoria, and probably more to come. We're looking forward to expanding in the West Valley within the years ahead, and we're already eyeing not only some medical group practices to hopefully acquire, but also some land to possibly further develop. Some of you may have started to see Honor Health FastMed locations. In September of last year, we entered into a business relationship with FastMed Urgent Cares. And so what's exciting about that is it gives us an opportunity to expand not only within the region, we now have locations in Tucson, for example, but also in the West Valley. So you'll probably start to see, if you haven't already, those locations in areas such as Buckeye and Avondale. So all of our career opportunities are listed at honorhealthjobs.com. I'm proud to say that we are growing leaps and bounds. This is an exciting time to be an Honor Health employee, in the fact that we have a lot of growth initiatives that we are moving forward with, including the opening of our 6th hospital, which happened last fall in the midst of COVID, but also we'll be opening a neuroscience institute and a behavioral health facility later this year. And right now we have 1,200 unique job opportunities available for job seekers. And we're very fortunate that we were able to offer nearly 3,000 jobs to job seekers last year in 2020. So because Honor Health is a culture of learning and development, that's one of the things we're known for, in addition to our community service outreach. I wanted to just highlight some of our sample hypothetical career paths. We welcome professionals of all levels, those who are entry level, those who are experienced, or maybe those who are re-careering and wanting to get into the healthcare industry. Our central sterile processing department is a great way for individuals to come into the hospital and start to make a difference, maybe starting in environmental services or housekeeping if they don't have previous healthcare experience. And do keep in mind, those are skills, housekeeping skills, for example, that are transferable from one industry to another. But our central sterile processing department, those are the individuals who are so important to our workforce, and the fact that they help decontaminate and sanitize our surgical instruments prior to surgery. So this is a great way, and you'll all be receiving copies of these slides, but they're also available on honorhealthjobs.com at the career development link. Another one of our sample career paths is our lab career path. And in partnership with education providers in the West Valley and across Arizona, we offer opportunities to our employees to start in an entry-level position, or maybe in one of the mid-level positions outlined on one of these career paths, and then upskill and be able to grow their careers with us. We want to really be known as a career choice home for our employees. And the last one is our nursing career path. I'm really excited because I'm building these out, and I'll be including IT, nursing informatics in the months ahead. So you've heard me mention our culture of learning and development, and we are so grateful that we have partnerships not only with ASU, the Maricopa Community Colleges, University of Phoenix, and other West Valley and local education providers to not only develop our workforce, but to recruit our new talent pools. As Trevor mentioned, it's kind of grim when it comes to the talent development outlook in the years ahead, but I want to think positively. I think in partnership with our education providers, and even if those individuals in these seats at these educational providers are only earning certificates, we can still utilize their talents, their skills, their expertise. And so, yes, we all have work to do as workforce development professionals, as community development professionals. But at the same time, employers also have some work to do in developing their workforce. And so that's one of the points that I want to make is Honor Health is really interested in working with their employees to pursue their academic, their professional passions, and giving them opportunities for continuing growth and development. And that's the thing about healthcare. Continuing education is definitely something that's required. So if you don't like going to school, then I don't know if healthcare is the place for you, but remember, our schools are so flexible now. There's so many different ways to go to school, online, in person, during the day, at night, etc. So just a few of our featured career opportunities. These opportunities on the left are our hot jobs. This list by no means is fully encompassing of the 1,200 positions that I mentioned, but these are the ones with immediate vacancies or where I project that we'll continue to have vacancies in the months, maybe even years ahead. And Honor Health is not unique in that area. It's something that all healthcare industry partners are struggling with. And so we're looking at ways, again, to strategically, creatively, innovatively develop our workforce. But I mean, take a look at this list. If you yourself are looking or know someone who is, certainly keep these in mind. And if you see an opportunity that appeals to you at honorhealthjobs.com, I encourage you to apply. You can apply for as many positions that are of interest to you. Being a certified career coach, I do encourage you to tailor your resume to each position. Please don't apply for 10 jobs in 10 minutes. Go through the process methodically and really speak the language, if you can, of the job posting as well as of our culture. Learn a little bit more about us. Check out honorhealth.com. You can always check the status of your application by going back into your profile at any time and clicking on the returning applicant login. And then, suspense is killing us. Honor Health benefits, just a brief snapshot of my favorite benefits at Honor Health. A full list is at honorhealthbenefits.com. And the nice thing about that website is nothing is behind closed doors, nothing is password protected. You can peruse our benefits and know how much you'll be paying per paycheck, what the coverage is, who the physicians are, etc. But I am biased. Our tuition assistance program is the best in the industry. $52.50 for all eligible employees. Don't have to participate in a lottery system to join the program. And as long as you're working 16 hours a week, 1/6, after 6 months of employment, you're eligible for either reimbursed tuition for non-clinical career paths at Honor Health, such as human resources, finance, marketing, or prepaid tuition for clinical programs such as nursing, respiratory, lab, etc. In addition to that, we offer $800 to $3,500 per year in continuing education support for professional development activities such as going to conferences, non-academic certifications, joining a professional development group. Medical, dental, vision insurance starts on day one after the first month of employment. Our 403B plan, nonprofit 401k equivalent, starts on day one, fully vested at an optional 4% company match, and 8 weeks of PTO and paid sick time per calendar year in your first year of employment. So if you'd like to learn more, please feel free to join our Honor Health talent community where you can upload your resume. And I'm kind of hovering over the URL, but I know the font might be small, so it's honorhealth.avature.net/talent community, or please connect with us and follow us on LinkedIn or Facebook. And so I thank you for the opportunity to be with you all today. And if you have any questions, I will look forward to hopefully addressing your questions later on today.
Leah, thank you so much for your presentation. Great overview, and also great advice about resume and tailoring that. I just want to remind our participants that you can please use the chat box if you have questions after this next presentation. We'll take a few minutes to answer those questions. Our next guest is Celine Slater from Banner Estrella Medical Center, the Laboratory Sciences of Arizona. Currently, Celine is the Administrative Laboratory Director at Banner Estrella Medical Center. She's been a laboratory leader in Laboratory Sciences of Arizona since 2003, with over 30 years in the laboratory industry in small rural community hospitals to large urban hospitals. Celine, welcome.
Hi, good morning, and thank you, Christine. I'm excited to be here today and present and highlight the laboratory industry. I've been in the lab industry. It's very diverse. There's lots of opportunity, and I'm so excited to highlight Sonora Quest, Laboratory Sciences of Arizona, and Banner Health, and how we, as an integrated network, all work together and the opportunities that it brings to the workforce. And hopefully technology will work with me here. There we go. So I want to highlight who works in the lab, what our business model is like, what our educational partnerships are, and our career ladders, and my computer. There it goes. There we go. Okay, now this hopefully makes sense. So as a visual, especially here in the Phoenix Valley, being a highly integrated system, it does get a bit confusing at times. So I wanted to highlight and explain how our companies work. So in our business model, Laboratory Sciences of Arizona, that's owned 100% by Banner Health. And so I'm sure if you've gone around the valley, you've seen and recognized Banner Health. And in the hospitals, we have about 1,300 employees working in those hospital labs. So as LSA, you'll hear me say that, we provide the oversight and strategic direction for the hospital labs. And then on the commercial side, the outpatient side, you might have heard advertisement for Sonora Quest Laboratories. And so of that, that is our company parents of Banner Health, which owns 51%, and a joint venture with Quest Diagnostics. And Quest Diagnostics is a national laboratory provider at 49%. Now, on that side of our business, we have about 18, almost 1,900 employees. So you can see almost 2,500 employees through our 2-3 businesses. So it also indicates a lot of diversity for our workforce, a lot of opportunity, and really lifelong career paths. So a little bit more about Sonora Quest. We were established back in 1997 here in Phoenix, Arizona. That's where our headquarters are located. We have patient service centers. So that's where our phlebotomists are working, drawing our patients, our outpatients, for that laboratory testing and sending it to our headquarters down in Phoenix. We also recently, in the last couple of years, have expanded our services and partnered with Safeway, where it brings that community convenience to patients. Well, it might be a little untraditional to go to the grocery store and get your blood drawn, but it just offers the opportunity for those laboratory professionals to serve our community. And as you can see how else Sonora Quest Laboratory provides laboratory services here in Arizona. So next I want to expand on Laboratory Sciences of Arizona. So again, we provide the oversight and strategic direction within the Banner hospitals. In Banner hospitals, we have over 30 now, not only in Arizona, but in 5 western states. And as you can see by this map, a lot of opportunity for rural, urban, and large metro hospital-based laboratory work. And in the West Valley, we have Banner Boswell, Banner Del Webb, Banner Estrella, Banner Thunderbird, and along the way, there are patient service centers. We have in-office phlebotomists and other rapid response laboratories. So a lot of opportunity for anyone that is looking for the lab industry. So like we want to provide what drives us in doing our laboratory work. So we're really more than just a lab. We are Arizona's leading provider of diagnostic testing and information. And so in delivering this, we are looking at innovation. Our industry is highly technically leveraged, so we proudly serve that continuum of healthcare. And so looking at what the community needs are, what those patient needs are, and the end all is that it provides a wide range of professional positions in our company. So a little statistics. Got to be in the laboratory of who works in the lab and about us more as an industry. So our clinical laboratory technologists and technicians, which you saw in Trevor's slides, we collect the samples, we perform the laboratory testing, and we provide those results. So lab tests guide more than 70% of the medical decision. So that is very significant, giving our lab professionals an increasingly important role in today's healthcare. And as also Trevor talked about some statistics as far as growth, Phoenix is growing, and in our industry aligned with a 7% growth in the next 8 years. So the careers in laboratory medicine. Well, medical laboratories are highly regulated, if not the most in healthcare. So graduation from an accredited program and appropriate certification is a requirement in many of our specific levels in our laboratory. I've highlighted a couple of here for careers in that pathway that indicate whether it's a Bachelor of Science, Associate's degree, and then also in our entry level, phlebotomists become highly trained and need to have a high school diploma or GED through a phlebotomy training program. Also in our industry, you can get more specific into certain degrees and training as highlighted as cytotechs, histotechs, and microbiologists. Before I go into the next slide, I just want to add a couple of salary-based questions we usually get is what salaries are these? So again, you can go on many search engines, but here Phoenix locally as an average. So for an MLS, that medical laboratory scientist, well, the average is around $71,000. Right out of school, that is a great salary and jumping off place to begin your career and build towards it. For a phlebotomist, it's around $35,000, and for an MLT, that medical laboratory technician, it's about $45,000. And also, I just want to bring, there takes a lot of us to deliver those laboratory results. And so in that, we have to have IT, we have to have sales and marketing. Of course, we have human resources, we have project management and Six Sigma, we have finance, we have our courier fleet, and we also have supply chain. So I'd like to highlight, as you'll see here in a moment, and also in the great video from ASU, we have relationships with local education partners, and a big component for us in the laboratory is that we do host student clinical-based externships. And so in that partnership, this gives a short but concentrated, it's a program that allows the student to experience firsthand that hands-on aspects of the business and the industry over a short matter of weeks, and it offers the job experience in that process. So we have partnerships aligned with ASU, Brookline College, of course, Maricopa County colleges with the highlighted careers there that I have listed. And so we do this from a strategic business aspect because it's supporting not only folks that are coming into the workforce, but those who want to grow in their career. So it's real-time observation of that student's knowledge and work ethic and building their skills. It supports that continuous pipeline of potential recruits for open positions and that career growth for our current employees. Like Trevor indicated, it's a way to expand our current workforce. And so just to highlight, even last year within COVID, we hosted 112 phlebotomy students, 3 clinical lab associates. We had 3 histo and cytos, and then over 57, we had 57 MLT and MLS students. So, and then also pre-COVID, we were hosting high school students, and that's the true joy, because we can see how they are interested in STEMI classes and how it is applicable and highlighting also the laboratory. Internally, we also have job shadowing, mentoring, and career ladder opportunities for our associates that are here to grow in their career and their opportunities. So I want to highlight our opportunities that we are currently hiring for. And I've divided this slide into those positions that do require that specific laboratory education and training, as our scientists and technicians, our phlebotomists, our lab assistants, and then we also have that first level of leadership, where the laboratory technical coordinator. And then the non-laboratory education opportunities, as you'll see here, from system engineering, those IT folks for the cybersecurity, and different opportunities there. We also have, and that's one thing I wanted to clarify, is that our job opportunities are listed on sonoraquest.com. But if you do go to Banner Health and you're looking for those laboratory opportunities, it will connect you directly link you into our Sonora Quest. So with that, and wrapping up for today, thank you. It's been an honor to share about the lab industry. And with any questions, I thank you.
Celine, thank you so much for your presentation. Trevor, Leah, thank you also for your presentations. We're going to take a minute and take some questions from the chat box. And there is one, Leah, for you related to a scholarship program. Does Honor Health have a scholarship program for medical assistant training and certification?
Well, this is one of my favorite topics, so I could go on and on. You'll have to stop me. No, so we do partner with several educational providers, including those within the Maricopa Community College District, to offer accelerated medical assistant programs, as well as our tuition assistance program covers medical assistant programs at a prepaid level after 6 months of employment. But then through our Honor Health Foundation, in addition to the $5,250 per calendar year, employees are eligible to apply for scholarships that are relevant to the endowed funds to continue and enhance those tuition assistance dollars that are available.
Wonderful, thank you. Do we have any other questions? Just drop them in the chat box. And as a reminder, this webinar and the previous 2 are located on the westmark.org website, and the resources will also be available to you after this webinar today. We are going to move into education training pathways, innovations, and partnerships. Feel free to continue to use the chat box throughout. We'll have some time again in this webinar. Our next presenters, Paula Livingston and Susan Campbell from Estrella Mountain Community College and Glendale Community College. Paula is from Estrella Mountain Community College. She's the Dean of Instruction and Occupational Education. She's adjunct faculty for the Business Program and Accounting. Susan Campbell is at the Glendale Community College, the Interim Dean of Academic Affairs and Career and Technical Education. She's faculty for Computer-Aided Design, Technology, and Architecture. Susan and Paula, welcome.
Thank you, Christine, and good morning to everybody. Paula and I appreciate the opportunity to be here today. Glendale Community College and Estrella Mountain Community College both support the West Valley's growing healthcare needs by providing education and training in several healthcare fields. All of our healthcare programs combine classroom instruction with high-tech simulation labs and hands-on clinical experience in healthcare facilities that are appropriate for each area of specialty. Each of our programs prepare students for any state board exams in any of their respective areas of expertise. We have a listing of some of the healthcare professions that we offer here. The Nursing Assistant Program, which is a short-term program that prepares students for employment as a nursing assistant. Students who complete the program and pass the state certification exam can go to work as a certified nursing assistant in as little as 5 to 8 weeks. Our RN nursing program is a 2-year degree program that prepares students to become a registered nurse. An RN is a licensed medical professional who works directly with patients, doctors, and healthcare professionals, typically in a hospital setting. Our Lpn Nursing Program is a 1-year program that prepares our students to become a licensed practical nurse who will provide patient care under the direction of doctors and RNs. We have an EMT program, which is a short-term program that prepares students to help in life-threatening situations, typically on ambulances and fire departments. And students can complete this program in as little as 12 weeks. This is a great stepping stone to other medical careers as well. Our Paramedic Program is a 1-year program that prepares students as healthcare professionals who provide emergency care to patients with life-threatening medical or traumatic emergencies.
In addition to the sorry about that. In addition to the programs that Susan has shared with us, Estrella Mountain Community College also houses the Southwest Skills Center here on our campus. It's officially administered by Gateway Community College, but they offer several programs within the healthcare industry as well. These are short-term clock hour programs. They include emergency medical technology, medical assisting, medical billing and coding, medical interpreter, ophthalmic medical assistant, pharmacy tech, and phlebotomy. So we wanted to share those opportunities as well. The strength and support of our programs is contingent and supported by our university and our industry partners. A couple of our university partners include ASU, NAU, University of Phoenix, Ottawa, Grand Canyon, and Upper Iowa University. To share a little bit more about those partnerships and some of the pathways that we have within our program, these are specific to our nursing program. We know there's a huge demand for both nurses and for students to get into the nursing program. So we're focusing on that one a little bit more. But both Estrella Mountain and Glendale have what's called the Concurrent Enrollment Program, or CEP. Basically what this means is that students are concurrently enrolled in their RN and their BSN degrees at the same time. So they're completing some of their RN classes in addition to their BSN classes. It's a way to allow students to graduate with both of those degrees that are critical for industry at the same semester or within one semester of each other. These are excellent partnerships with our university partners that allow us to do it, and it provides a more affordable option for students to complete the BSN. Again, partners such as ASU make these pathways possible for our students.
We also offer an honors cohort for our high school students. These are recent high school graduates as well. If you qualify for a President's Scholarship, which is a 3.25 GPA or higher, you're eligible to join a cohort each fall. Students progress as a cohort through this Maricopa Nursing and NAU pre and co-requisites, as well as the associate degree and BSN program, and it's at a substantially reduced cost. The President's Scholarship can cover the majority of the community college tuition for those who qualify.
In addition to the concurrent enrollment program and the honors pathway that Susan just spoke about, we also have pathways with Grand Canyon University. It's the AAS to MSN pathway. So this is for those people that might already have a bachelor's degree and now they'd like to pursue something in nursing. So they complete their AAS with us and then they're able to move on to Grand Canyon University and do 18 credits there at a reduced tuition cost. Additionally, we have a nursing pathway, a 3+1 pathway with the University of Phoenix, allowing students to complete 3 years at the community college and then do their final year at the University of Phoenix in an effort to maximize the transfer of credits. They have pathways into the Bachelor of Science in Management, Bachelor of Science in Health Management, and the Bachelor of Science in Nursing.
Shouldn't give two of us controls. These are some of our West Valley healthcare partners that our students get their clinical experience at. We appreciate the support and the education that these partners provide. Clinicals provide our students with hands-on training with real patients in patient care, behavioral health, obstetrics, pediatrics, and surgical care, to name a few. In addition to the classroom, our students are also involved in healthcare for the community. Some examples include the COVID-19 vaccinations. Our nursing students have administered the COVID-19 vaccinations for Banner Health and Abrazo. Students not only provided these vaccinations, but they learned about healthcare systems emergency response and safety protocols, and they participated both as vaccinators and as medical observers. Glendale has a refugee teaching project in partnership with the International Rescue Committee. The nursing students gain cultural knowledge and experience as they provide hygiene and nutrition education to help prevent type 2 diabetes and hypertension. This is important as our refugee groups have disproportionately higher rates of developing these diseases than the general population. We also have an Alpha Pi Honors Nursing Society, and students in this society have given back to the community by completing community service each semester. They've helped with packing boxes with Feed My Starving Children. They've donated blood. They've helped with flu shots at clinics. They've also volunteered at COVID-19 sites and put together hygiene kits for the homeless. Anything they can do to help make a difference for the community.
And definitely the COVID-19 pandemic has provided us with an opportunity to look at the ways that we deliver nursing education. As Susan shared in the beginning, both Estrella and Glendale have state-of-the-art simulation facilities that were incredibly helpful when we were no longer able to get students into the clinical settings. So we appreciated having those. Additionally, we are exploring other opportunities to provide comprehensive clinical experiences for students, including the potential to incorporate virtual reality or augmented reality into our curriculum. So we're excited about some of the advancements in nursing education at the community colleges. Lastly, we just want to provide you with some contact information. If you have questions about any of these specific programs, you can reach out to both the program director and the program coordinators at each college to find out more information about getting into one of these programs. Thank you so much for allowing us a few minutes to share about the programs at the Maricopa Community Colleges.
Paula and Susan, thank you very much. And to our participants, just a reminder to use the chat box if you have questions for them. We're going to move on to our next subject matter expert panelist. We have Caryn Unterschuetz. She's from ASU, a clinical assistant professor at the Edson College of Nursing and Health Innovation, and she is the internship coordinator for non-clinical baccalaureate degrees and Master of Health Innovation students. She teaches undergraduate and graduate health innovation courses. Caryn, welcome.
Had to unmute. Good morning, and thank you for having me. My name is Caryn Unterschuetz, as Christine said, and I am an assistant clinical professor and internship coordinator in the Edson College of Nursing and Health Innovation. My master's degree is in health innovation, and I've been an RN for over 40 years. I'm grateful to have been asked to present today to share information about the internship program for our non-clinical health degrees. So why do students do internships? Students in their internship organizations get exposed to professional workforce experiences. They can explore different job opportunities while working with various departments on diverse teams. Many interns gain valuable insight into what they would like to do after graduation. At times, they also gain insight into what may not work for them when entering the workforce, and whether the intern chooses to continue on the path they experienced during the internship, or they decide that the experience was not something they will use after graduation. They are both valuable learning opportunities. So why should an organization sponsor an Edson internship? Well, they can find future employees. They get to see how the work ethic is of our interns. And hopefully they get to see what they're going to be like as an employee. They can increase productivity for their organization. Our interns are really good at doing projects, research, reports. They bring motivation and enthusiasm to your organization, which really can help in the culture of the organization going forward. They can work on your social media if you're having difficulty with that. But the biggest thing is when you sponsor an internship, you're giving back to our community. So these are our Edson Internship Degrees that we are sponsoring. We've added a couple new master's degrees. And so we have community health, care coordination, and integrative health. Then health entrepreneurship and innovation, healthcare compliance and regulation. And then at the graduate level, the Masters of Healthcare Innovation, the Masters of Clinical Research Management, and coming soon is our Master of Food Safety. So Internship Basics. On the slide, we have fall and spring semesters. Sorry, my screen just got very small. There. We have fall and spring semester sessions that go about 15 weeks for the whole C semester. And then in the summer, we have a dynamically dated program that's about 12 weeks. And students have the ability to choose a 1 to 3 credit internship, depending on how many hours they need for a elective. Internships can be in person, they can be virtual, or a combination of both. Over last year, we were basically virtual, and thank goodness for our Zoom abilities to talk to our organizations. So in our course, we study what I like to call is real skills. Those are those skills that are needed in today's workforce and listed on the slide. Often I've seen in articles that they're called soft skills, but I think real skills is a much better interpretation of what soft skills are. We need to change our thinking and begin looking at these real skills as essential tools for use in an Edson College graduate's toolbox. Students write weekly reflections about what they learned in their organizations and answer questions related to real skills studied in the module. Weekly reflections allow the student to take charge of their learning by reviewing how they were successful, what they want to improve, how did they grow this week working on real skills, and what goals they set to move learning forward. The exponential growth of the students after experiencing an internship is absolutely remarkable, and I have the honor to see it every semester. So here are some of our internship organizations that we have affiliated with. Most of our internship organizations are located in downtown Phoenix, Tempe, Mesa, and Scottsdale. But Edson College of Nursing and Health Innovation is very excited to announce we are scaling the program to expand internships for our West Campus students in these degrees and ask our West Valley organizations to join us in our experiential learning opportunities. So, a little bit about Edson's vision for the future of healthcare. We must lower healthcare costs, continue the movement toward a wellness model, and hire our bachelor's prepared health graduates in the healthcare system. These Bachelor of Science graduates can do many of the assigned tasks that were assigned to licensed professionals in the past, freeing them to work at the top of their license. 3 of our care coordination students began a pilot in spring 2020 within Banner Health until COVID emerged. The students were assigned to the case management department at 2 West Valley Banner facilities. They reported high satisfaction with their experiential learning. Our students were able to shadow social workers and RN case managers as they supported patients getting ready for discharge to home or a rehab facility. As we continue to see social determinants of health disparities, Edson community health graduates can work in neighborhoods or community centers to help residents find resources within the community and government agencies. Many of our interns are bilingual, not only in Spanish, but other languages. Healthcare compliance and regulation majors have completed internships within the Office of Inspector General. They have assisted in research projects, reviewing records of disciplinary actions, and writing reports. Students have also been instrumental in developing public service announcements and videos. Health, entrepreneurship, and innovation interns, like myself, like to be embedded in startup companies. There they learn about what it takes to bring a new product or process to the marketplace. They understand the big picture of change management in complex systems. Interns can be helpful if an organization is considering making changes. So here's our contact information. My other colleague is Dr. Therese Spear, and we would love to add your picture here for the next time we present. Over here on the right side is a picture of our intern at a company called Spark Systems, and she was learning how to do evaluation of physical abilities, shall we say. So I want to thank you very much. I hope you will consider internships. We have many students in the West Valley. And if you have any questions, please feel free. Here's our contact information again. And I thank you for the ability to present today.
Caryn, thank you so much for your presentation and leaving your contact information. Before we move on to our next presenter, we have a question in the chat box for Celine related to internship opportunities for phlebotomy. Wondering if you could answer that question.
Hi, well, thank you for the question. I'm going to keep it really simple. If you'll go to sonoraquest.com or to my email, I will help direct you. There are loads of different opportunities depending on your current experience or maybe what you have now and then where you want to build. So just to kind of keep it simple, give me a call.
Awesome. Thank you, Celine. And Leah, we also have a question for you in the chat box, but it's personal, related to a personal situation. So I'm going to ask the participant to reach out to you based on the contact information that you provided. So those are all the questions that I see. We are going to, again, move on to Marjon Forouzeshyekta. Marjon, I tried. Hopefully I got that. Marjon, welcome. She's a faculty member and degree director at ASU's College of Health Solutions. She leads one of the college's largest and most popular degrees, the Bachelor of Science in Medical Studies, which prepares students to pursue medical school and other professional graduate programs in health and healthcare. In addition, Marjon is the faculty's honor advisor for medical students in Barrett, the Honors College at ASU, and she received her doctorate from the Texas Chiropractic College. She has a Bachelor of Science in Biology at the University of Texas, San Antonio. Marjon, welcome. I think you're muted.
Thank you so much for that introduction. I appreciate it. And I would like to go ahead and get started if we could pull up the slides. Perfect. Thank you so much. I'm very excited to be here today to share with you a little bit about our College of Health Solutions here at ASU's West Campus. And thank you again for that wonderful introduction. A little bit more about specifics. I've been at ASU for the past 10 years, and through this role of being the degree director, I've had the opportunity to work directly with students as they complete their educational journey here at ASU and eventually enter into the healthcare workforce. So just a little bit of an introduction to our college before we get started. So we have about 6,207 total students. Most of our students are undergraduate, but we also have a fair amount of graduate and online students. So there's a lot of flexibility in our programs. Specifically here at the West Campus, the College of Health Solutions offers 5 undergraduate degrees. Those degrees include the Bachelor of Science in Medical Studies, the Bachelor of Science and the Bachelor of Applied Science in Health Sciences, the Bachelor of Science in Population Health, and the Bachelor of Science in Healthy Lifestyles and Fitness Science. And today I'm going to just provide an introduction to the first 2 that are listed there, the Bachelor of Science in Medical Studies and the Bachelor of Science in Health Sciences. Those are our 2 largest programs and are very popular among our students. So built into our programs, we have clinical internship opportunities and research opportunities, which are very attractive to our students who wish to enter into various healthcare fields and health administrative positions. They get that hands-on experience in different types of healthcare environments. So some of our community partnerships are listed here, and it was wonderful to meet some of our partners earlier on in this past hour with their presentations. So Mayo Clinic, Dignity Health, Banner Health, Honor Health, Valley of the Suns YMCA. There's also some sports teams we're associated with, the Phoenix Suns, the Arizona Cardinals. So these partnerships are wonderful because our students get to complete their internships at these facilities, and they are working under the direct supervision of healthcare providers, and again, getting that field experience as part of their time here at ASU. And of course, the internship opportunities that are located here in the West Valley, closer to home to our ASU West Campus. And I'm sure you may recognize some of these, but we're all the way in Glendale to Avondale to Peoria to Sun City West, and some of those facilities include Elite Chiropractic and Wellness, Foothill Sports Medicine, New Spring Pharmacy, Copper Springs Hospital, Ohana Eye Care, Brookdale Senior Living, as well as some of the school districts out here. So again, our students are interning at these sites. They're working with healthcare providers, healthcare workers, and eventually when our students graduate, some of them are actually hired at these exact facilities where they were interning at. So it's a beautiful relationship that develops for our students. And again, they can use these experiences in their applications, in their resumes, CVs, and this is something that really is helpful in their future careers in healthcare. So I'm going to start with our Medical Studies Bachelor of Science program. This is the largest program that's offered at our college, and it's a 4-year bachelor's program. The locations vary, so all of our degrees are offered across multiple campuses, downtown, west, Polytechnic campus. This degree program is the largest because it's very popular among our students who wish to enter into a health professional program once they graduate. So those programs include medical school, dental school, pharmacy school, optometry school, physician assistance programs, and integrated healthcare programs. So this program basically prepares our students by fulfilling the prerequisite courses that are required for entry into these programs, as well as preparation for the entrance exams that are required for each of these programs. And some of the classes that students take in this program include courses like healthcare ethics, cultural aspects of health, leadership and professionalism. And it's important to note that our courses are taught by faculty who are healthcare providers. So again, inside the classroom as well, those experiences are being shared with students. We also have a hospice and palliative care certification that is one of our partnerships with Hospice of the Valley, located here throughout the Phoenix Valley. Their program provides a certificate that can be used again on applications, resumes, as experience in the healthcare sector. And basically, our students are interning at their facilities and again, working directly with healthcare providers and seeing patients, specifically hospice and palliative care patients, and again, gaining that valuable hands-on experience. Just some numbers here for the career outlook for this program. And after, of course, the students graduate and enter into those health professional programs, what the expectation can be in terms of salary. So I have a few numbers listed there for your review. The next program is another one of our larger programs here at the college, and this is the Health Sciences Bachelor of Science program. Again, this one is offered across multiple campuses, but this one also has an online option, which is, again, something that is great for some of our students who are currently working. This program is a little bit different from the Medical Studies Bachelor of Science program that we just covered, which was more for students who are interested in becoming healthcare providers. This one is more of a healthcare administrative role or a healthcare administrative position. Some of the tracks or pathways that students can pursue with this degree include community-based health outcomes, health legislation and regulation, integrated care, language, speech, and communication, and we also have a Mayo echocardiogram track, which is very popular amongst our students. You can see here again the career outlook for this degree, and again, these are more administrative positions rather than healthcare provider positions that we saw with the previous degree. A little bit of a difference, but still a very popular degree amongst our students. So as part of your experience at the university, we also offer career and professional development services, which are really helpful. So we have career and industry specialists. They work closely with all of our College of Health Solutions students, and they'll assist you with basically your resume, cover letter, doing mock interviews. So while you're here at ASU completing these programs, not only are you gaining the educational experience you need to be successful in the workforce, but you're also preparing for applying for these jobs and eventually entering into the healthcare workforce. Additionally, we also have pre-health advising, and pre-health advising is important because these health professional programs have certain requirements that you need to meet as a student. So you're going to need to start volunteering, gaining clinical experience. Now that's kind of textured into or put into our degree program. So you'll gain the internship opportunities and experiences. You'll do research while you're here, which again helps with getting into those programs. You'll be able to get involved with student clubs, organizations, and of course preparation for these important entrance exams, which you can see are listed here, the DAT, the MCAT, the PCAT, as well as the GRE if you're continuing on with a master's degree. And then of course there was a question that was asked about financial help and scholarships. So we also offer those as part of the services here at the university. So if you go to scholarships.asu.edu, you can do a scholarship search for the semester that you'll be joining us to see what's available. And you know, the application process will come up, and what's needed to apply for those scholarships will be available here on this website for those students who are interested. And I highly recommend you doing a search because there's a lot out there, and it's going to help with the cost of the education. And that's just kind of a brief overview in the time we had. Thank you so much. If anyone has any questions, we'd be happy to answer those questions. I have a general email there and a phone number that you can reach and contact us if there's any additional questions that we can answer. Thank you so much.
Marjon, thank you very much. Great presentation. We don't have any questions in the chat box as of right now. We are going to move on to our next presentation from Collene Bay Anderson. Collene is Vice President of Healthcare and Academic Affairs at the University of Phoenix. Collene helps University of Phoenix partners overcome the challenges they face in employer education, training, and employer retention. Collene, welcome.
Thank you. Hi, everybody. And I believe I'm the last presentation, so last but not least, I will take you through some of the University of Phoenix programs and some of the solutions that we're also offering. And it was really great to hear some of the other solutions and talk about some of the employer partnerships and community college partnerships that are going on in the West Valley, because I think it's so exciting to see all of these great new things that are happening and how we're supporting students and how we're supporting employers to really meet their goals. So lots of good stuff going on, and it just seems like Westmark's really been so active and involved in supporting everyone to come together. So with that, I will start with an overview here of University of Phoenix, and let me see here if I can get the controls to work.
Colleen, while you're getting that to work, I just wanted to let our participants know we do have a couple other presentations after you. So
we do. Okay, I'm sorry.
No, all good.
Okay, so to get started, one of the things that University of Phoenix has really been focused on is how can we support the workforce of the future? And in looking at the workforce of the future, we know that there's going to be some pretty significant skills gaps coming up in the next couple of years. What we do know is that about 42% of all employers are going to need to either upskill, or those employees are going to need to replace or refresh their core skills by 2022. And this can be a pretty big problem for a lot of employers if they're really not preparing or gearing up to be able to address those different skills gaps that are going to be happening across multiple industries, and healthcare, of course, is no exception to that. And moving on to the next slide, and I'm sorry, I'm seeing a little bit of a delay on my side. What we also know is that about 53% of half or all workforce will need to change their core skills and capabilities over the next 3 years. We know that technology is advancing at a very quick pace, and I think COVID and the pandemic and everything else that happened in the economy really sped that process along. So we're seeing it happen a lot faster than we thought we would. So when working with a lot of the different employers across the West Valley, we're having a lot of conversations around, how can we prepare for this problem? How can we help meet the needs? And what types of solutions are out there to help solve some of those problems so that they can retain talent or even find the right talent in the future? So there's a couple of different ways that University of Phoenix can help. One thing that we know is that the workforce is evolving and talent needs are fairly diverse across all spectrums and healthcare industries. And one thing that employers are really looking to do, and what we're seeing across our West Valley employers as well, is they're struggling to not only find quality candidates, especially in the healthcare area. I know that it's difficult to bring in nurses, it's difficult to find folks in IT, technology, artificial intelligence. A lot of healthcare organizations have shifted to a pretty significant telehealth platform, and managing some of those technological advances as well. Keeping their workforce relevant, because it seems, I don't know about you, but it seems like technologies and the industry changes day to day, and we're seeing constant changes and constant evolutions in the different types of skill sets that we all need to have in order to stay relevant. Reskilling our workforce, retaining our workforce, and making sure that the employees that we do have will stay and that they're contributing significantly to the organization. Engaging and growing our talent as well, so skills enablement, and then of course support transitioning employees, so outskilling employees as well. So these are some of the challenges that we see employers are really looking to solve. And we're seeing students coming through the community colleges as well that we're trying to prepare to meet the needs of that future pipeline and talent workforce. So what are some of the things that we can do as a university to help support those needs? One thing that we have been working on, and we've been doing this quite some time, is really tailoring some of those custom solutions towards the needs of a specific employer, whether it's creating fast track opportunities for certificates, upskilling, short burst learning, micro learning. We're bringing on some badging and other types of certificate options as well that employers can engage their employees with. If they're looking for something, more in medical billing and coding, if they're looking for digital marketing, upskilling in certain technology areas like cyber, how can an employer really utilize and leverage some of these short burst 40 to 60 hour certificates to really upskill their workforce and get them to where they need to be, or find the right folks in those areas. We're also looking at expanding a lot of our certificate options, our 18-month stackable certificate options as well, where students can come in and they can complete an 18-credit, 18-month certificate that is stackable into any bachelor's or master's program that leads to industry-level certifications, and then can, of course, also be used to complete their degree at the end of the day. So there's a lot of options there as well with our health informatics programs, again, going back into cyber security, management, nursing leadership, project management, the list goes on and on of the different options for those degrees and certificate programs that are really aligned with industry occupations, again, geared towards getting folks into a job, geared towards meeting some of those skills gaps and those talent needs, and then of course creating a talent pipeline for future employees as well. We've also been engaging pretty heavily in the last year in apprenticeship options as well. We've been working with several different apprenticeship partners that are rolling out federally funded or supported apprenticeship programs in areas like phlebotomy, pharmacy tech, machine operator, IT options, very different IT options as well, where a student can come in through a community college channel or even come in as a direct hire into an apprenticeship program with an employer that an employer is supporting. That apprenticeship is paid and supported, and that student is paid through their apprenticeship program. They earn a significant bucket of credits towards a bachelor's degree as well, and then that student can then turn around and come back to University of Phoenix to finish their bachelor's degree in under a year with little to no out-of-pocket cost. Most of these programs are usually supported and funded by the employer as well once they get to the bachelor's or the master's level, so that student's really not going to have a lot of student debt, and they'll be working in an industry where they're making a pretty significant income and have the opportunity to advance in their career as well along the way. So that's just a high-level overview of some of those apprenticeship options. But if you're interested in learning more, I will provide my contact information here at the end of the presentation, and we can talk about how to set up those types of options within your workforce. And then some additional solutions that are also delivering on that long-term investment for the employer. Connected learning pathways like the 3+1 with our Maricopa Community College system. We're offering students the opportunity to be able to complete 3 years worth of their degree program at the Maricopa school system, and then transfer all 87 of those credits into University of Phoenix to complete their bachelor's degree in less than a year. There's also tuition benefits and reductions in there as well, so students can take advantage of savings. They can take advantage of coming in and completing their degree under $10,000, and then also being able to spend more time at their local community college there with Maricopa, staying with their classmates and staying in their local community before they move on to complete their bachelor's degree. We've also been developing pathways around prior learning assessment as well. So a lot of your industry certifications, your allied health certifications, your RN license, medical licenses, those types of certifications also equate to a pretty significant bucket of college level credit. So the students that are also coming through some of those technical, vocational, or allied health types of programs can really leverage that industry licensure or any other type of training they may have received outside of their college program, and then apply those credits towards their degree at no charge. So they don't have to repeat any courses, they don't have to pay any additional tuition for what they already know, and then they can leverage that industry licensure towards their degree program. Oops, and I think I skipped too far ahead here. There we go. And then going back to some of the tuition costs as well, we've been working with some of our partners across the valley. Honor Health, Banner Health are some good examples, Phoenix Children's Hospital as well, where we've been implementing a customized tuition, what we call a TAP cap program for our employers, where students can come in and they can take a bucket of courses throughout the calendar year. Their tuition is capped at a $5,250 price, and all of their fees are waived. So typically that $5,250 pricing is aligning with the employer's tuition reimbursement program. So that's the max you can take for your tax write-offs at our federal level. So with the 5250, most students are able to leverage that 5250, take a full-time workload or course load during their bachelor's or master's program or their doctoral, and then be able to complete their degree program with zero out-of-pocket cost, because our fees also include our books as well and any e-resource or access to electronic technology. And so all of those fees are waived as well. So one of the biggest goals, with the apprenticeship programs, the certificate programs, the PLA and everything else really is to reduce the cost of school for the student and make sure that the student can maximize, bring in as many credits as possible and really have little to no out-of-pocket costs. So helping the student leverage all of those resources that are available to them to make sure that that's happening, because we really want to get away from students being in debt or having a lot of debt that they have to deal with over the next 10 to 20 years. Okay, and then just giving you an overview of some of those transfer pathways. We've got a couple of different programs in our colleges. So all of our programs are regionally accredited as well as nationally, and most programs are programmatic accredited as well. I'm going to quickly go over some of the different programs that are offered through the various colleges. So as you can see, we've been offering programs for around 40 years. Most of our colleges, our College of Business, Healthcare, IT, are made up of industry advisory councils that are various leaders in the field, several leaders locally here in the West Valley and the Phoenix Valley as well. And we're also accredited through the Higher Learning Commission. Our different degree programs are also designed to save, like I said, save time and money. So we're looking to bring in as many credits as we possibly can. We're also offering now competency-based or CBE education programs in addition to our standard bachelor's and master's degrees. Our School of Business is one area where we did recently launch an MBA CB program that can be completed in about a year. But we also offer your standard MBA and your MBA Bridge program, as well as 4 bachelor's options under the business school. In information technology, we're also offering the master's in security in CB as well, which is our CBE or competency-based program, in addition to 3 other master's degrees, 3 bachelor's, and 13 certificate options. Most of those certificates are also aligned to industry level certifications as well, so that students can go out and they can sit for those exams. In our healthcare area, we're offering 2 bachelor's degrees. We have our Bachelor's of Science in Health Management, our Bachelor's of Science in Health Administration, and then we're also offering 6 master's degree options. One of those includes the Master's of Health Administration, which is a competency-based option. All of our MHA programs are CAMI accredited, and our BSHA program is aligned with the HIMSS National Programmatic Accreditation as well. In fields such as nursing, we're offering 2 bachelor's degrees, a standard RN to BSN post-licensure program and a BSN competency-based option as well. We offer 4 master's programs, which includes a nursing bridge program, our FNP option, family nurse practitioner, our doctoral degree, which is our DNP or doctoral in nursing practice, and then 2 graduate level certificates as well, both which are all CCNE accredited. In fields of education, we're also offering initial licensure programs for those that would like to become a teacher. I know that's a big need in the Valley as well, outside of healthcare, is filling those teaching roles and positions. So we do offer those programs here locally where someone can bring in their bachelor's and become certified or licensed to become a teacher, single or multiple subject. And then also in the fields of liberal studies, we're offering a Bachelor's of Art in English, a Bachelor of Science in Environmental Science. And in the last 2 colleges, we have our Criminal Justice, Security Management, and Public Administration programs, where we offer our 1 associate's degree, 3 bachelor's, 2 masters, and we're rolling out our Bachelor's in Public Health relatively soon, in addition to a master's in public health later on in the year. And last but not least, we've awarded about 426 different doctorate degrees. We've got about faculty with about 26 years of average professional experience in their field, and currently we're offering a few different options here for our doctoral programs. We have our Doctorate of Business Administration, Management, Education, Health Administration, and our Doctorate of Nursing Practice. We also recently launched our doctoral certificate programs, which are 18 credit doctoral certs that can be taken outside of the doctoral program. So if someone would like to pursue their doctoral cert, they can do that, and then they can bring those credits back into a doctorate program later if they choose to come back and pursue their doctorate program. Just giving you a little idea there too of some of the organizations that we work with in the West Valley that we've had longstanding relationships and partnerships with, including Maricopa, LifePoint, Kindred, Phoenix Children's Hospital, recently with the state of Arizona, City of Phoenix, Peoria, Cox Communications, Honor, and Banner Health, of course, that are on this call, SRP, and Blue Cross Blue Shield of Arizona. And if you have any questions, I wanted to provide our contact information there. We do have a local campus here in Phoenix. Jeff Hendrickson, who's on the call today, is our local campus director, and his information is provided here. And then if anyone has any further questions around any of the solutions, talent solutions management programs, please feel free to reach out and let me know. My email is also listed below. So with that, thank you all for your time. And I look forward to any future questions or feedback.
Colleen, a brief question in our chat box. Are there any master's program in social work or related?
We do offer a bachelor's program in social work. However, it is not approved at this time in the state of California, or I'm sorry, California and Arizona. So it is offered outside of Arizona.
So not a master's, just a bachelor's?
It is
Okay.
a bachelor's in LSW.
Fantastic. Thank you for your presentation.
Yeah.
We are going to move on to Harvey Smith, Arizona at Work. Welcome.
Good morning, thank you. What an amazing, informative panel we put together, and I hope this has whetted your appetite for exploring healthcare. It is such a diverse and interesting field. So, my name is Harvey Smith. I'm a business service representative with Arizona at Work, Maricopa County. I'm a sector specialist in healthcare, specifically in the West Valley. So, as you can see, amazing opportunities. So the real question is, what can we do? Okay, not advancing. Okay, so Arizona Work Maricopa County is part of the statewide Workforce Development Network provided to you by the Department of Labor's Workforce Innovation and Opportunity Act. We provide services to both job seekers, all job seekers in Maricopa County, and businesses, including healthcare, that are looking to fill vacancies. So we assist employers in their search for and attempt to retain and develop the best employees for their current needs. So where do we keep our jobs? Well, we keep them on Arizona Job Connection. You'll hear us refer to this as AJC. As of this morning, we have about 60,000 posted jobs on here, which can be searched on location and or industry. So that's kind of a nice place to start. Now, if you're a job seeker and you come to us, what do we provide for you? Computer access. You know, it's fine working from home if you don't have a house full of kids. So sometimes you just need somewhere quiet to go and do your application. We can help you with that. Job leads. It can be a little bit challenging. We've got 9 different panelists this morning and they're all hiring, so where do I start? We can help you with that. I hope you've seen just how diverse healthcare is, and sometimes the job seeker needs to explore their options. Maybe they really want patient care, or maybe they don't want patient care. Maybe they're interested in the lab side, or maybe they're interested in the IT side. We can help. We can help you discern what is the best approach for you. Several of the recruiters today talked about resumes. Resumes are something we can help with, something we can assist you with. If you have a resume and it's not getting you the interviews, come and see us. Don't be shy. Interviews can be quite scary, can be quite challenging. And again, we can help you with the interviews. Don't do this by yourself. Let us help you. Twice a week, we send out a job blast. This is a list of jobs based on location or industry. It also includes community resources and other information. We assist with the Arizona Career Readiness Credential. We'll come back to that in a minute. And occupational skills training. Now, all of this information can be found on our website, www.maricopa.gov/find-a-job. So we talked about the job. This is how you sign up for it. You whip out your smartphone and you text AD@work 22828. It asks you for your email address, put it in there. We'll start sending you job lists within the same week. Now, the Arizona Career Readiness Credential, earlier today we heard about real skills, and that's fantastic because this speaks to real skills, soft skills. Governor Ducey, when he became governor, was spending a lot of time talking to the business community, and the business community said, look, soft skills, real skills, are really difficult to measure. Is that something we can create or something that we can use to help us truly understand the soft skills of the job seeker? And the answer is yes, it is the Arizona Career Readiness skill. Not an easy thing to do. It takes a bit of practice and is great for the recruiter because you can see, okay, is this person technically gifted? Do they have really great people skills? Should they be in customer service? Should they be in IT? Should they be, so it allows you to discern quickly the fit. Occupational skills training. Everybody today has talked about training, ongoing training. And through the Workforce Innovation Opportunity Act, we have the opportunity to provide funding for job seekers to upskill or reskill based on needs. So how do you find out more about this? Well, go to maricopa.gov/find-a-job. So thank you very much for your time today. Sorry about the ringing phone. I'm the only one home, so I can't go to it. If you have any questions, please reach out to me. My telephone number is 602-527-5136. Not the phone you're hearing ringing. My email address is harvey.smith@maricopa.gov. Thank you for your time.
Harvey, thank you so much for your presentation, and feel free to drop that information in the chat box for our participants. Our last presenter, Mary Foote. Mary is the Managing Director of PipelineAZ. Mary, welcome.
Thank you, appreciate it. I'm having some issues with my video, so I'll just stay off video as I go through my portion of the presentation quickly so that everyone can get out of here in time. Okay. All right, so PipelineAZ is a community-funded resource. We match job seekers and employers based upon skills. So just ask everyone who's participating in this event, trying to identify job opportunities, to look for westmark.pipelineaz.com. It's part of the West Valley Pipeline strategy to build their profile there. Oops. Okay, so we do also have the ability to match with a number of training opportunities as well. So you heard some great information about different educational institutions and providers who have opportunities available. So using your profile, we can match you to jobs and training based upon your goals, interests, and skills. And so you'll just need to set up your profile. Sign up's easy, so you don't actually have to sign up to begin exploring. However, registration does allow you to save the results of your assessments and create a profile. So by creating a profile from the top navigation bar, it's going to allow you to match the job opportunities based upon those skills you add in your profile. Make sure you add your education and experience. This is what allows our back-end algorithm to understand what skills are associated with those jobs. You don't have to upload your resume, although a lot of employers do like to see those. If you don't have a resume, the profile builder does allow you to build a resume within the platform. Make sure you add any additional experience. So if you don't have skills that are necessarily from a previous position, you can add in any certifications, especially with this particular hiring event. Lots of very specific skills and certifications that you can add to be matched to the positions you've heard about today. And you can access your profile at any time. It can be set to either public or private. So if you do find a position, get matched, get hired, you can just go ahead and make it private, and then just only make it public again when you're looking for job opportunities. And again, if you get lost, that top navigation bar is going to help you find your way. You can also explore different career pathways and training opportunities up there for upskilling and reskilling. We do also have career coaches available. So if you have any questions about building your profile or trying to understand why you are or not matching to specific positions that may be of interest in your customized feed, we're happy to answer any questions you have or direct you to appropriate training opportunities, again, to get that upskilling or reskilling opportunity. So thank you so much. Again, you can go to PipelineAZ.com, but we're asking everyone for this event to go to westmark.PipelineAZ.com so that you can learn more about the opportunities specifically available in the West Valley. Thank you.
Mary, thank you so much for your presentation and for wrapping us up today. I want to say thank you to all of our panelists, phenomenal value for all of the participants. Thank you to Westmark for hosting this webinar, and to our sponsors, ASU, specifically University of Phoenix, for this healthcare spotlight. You can find this webinar along with others in the series at westmark.org. And the job matching component, as a reminder, the job matching component of this webinar begins today through April 27th. And to access this option, please register online at westmark.pipelineaz.com. Thank you, everyone. Have a great day.